Child sexual abuse is a topic that most people would rather avoid. But before we can talk about prevention, we must have a clear understanding of what child sexual abuse is and how it affects children. Child sexual abuse is the exposure of a child to sexual contact, activity, or behavior where consent is not or cannot be legally given. Due to their age, children simply cannot give meaningful consent to sexual activity. The National Child Traumatic Stress Network describes sexual abuse as any interaction between a child and an adult in which the child is used for the sexual stimulation of the perpetrator or observer. Sexual abuse may include touching of the vagina, penis, breasts or buttocks, oral genital contact, or sexual intercourse. It may also involve non-touching behaviors such as voyeurism, exhibitionism, or exposing the child to pornography. A central characteristic of sexual abuse is the domination of the child through deception, coercion, or force. Research has shown that child sexual abuse is most often perpetrated by someone the child knows and trusts, someone like a parent or guardian, family member, caregiver, neighbor, or friend. It's difficult to know just how many children are affected by child sexual abuse, but some research has shown that 1 out of 4 girls and 1 out of 6 boys will be sexually abused before they reach the age of 18. Children of all ages, races, gender, and socioeconomic backgrounds are vulnerable to sexual abuse, but research shows that girls are at greater risk than boys, as are children with a disability or who come from lower income families. Children who are exposed to violence and other forms of abuse are also at greater risk for victimization. One of the devastating effects of child sexual abuse is the silencing of the child. Children rarely disclose abuse, and boys are even more unlikely to report than girls. This happens for a number of reasons. The perpetrator may have threatened the child or convinced them that no one will believe them. The child's abuse may have been photographed or filmed, and the child fears disclosure. If the perpetrator is someone the child loves and trusts, the child may fear that he or she will get in trouble. The child may fear that he or she will be removed from their home. Children may feel that they are responsible for their abuse, leading to a lifetime of shame and guilt. If children do not disclose abuse, how can we identify a child who has been abused? Pay close attention if a child in your care displays the following behaviors: an increase in nightmares and/or other sleeping difficulties, angry outbursts, anxiety or depression, difficulty walking or sitting, withdrawn behavior, pregnancy or contraction of a venereal disease, especially if under age 14, propensity to run away, refusal to change for gym or to participate in physical activities, regressive behaviors for their age such as a return to thumb-sucking or bedwetting, a reluctance to be left alone with a particular person or people, sexual knowledge, language, or behaviors that are unusual and inappropriate for their age. Remember, it takes enormous courage for a child to come forward. If a child in your care discloses abuse, it's important to listen, remain calm, and to reassure the child that they did nothing wrong. Once abuse has been disclosed, provide a safe environment for the child and contact local authorities as soon as possible. Thank you for taking the time to listen. Please watch as we continue our discussion on child sexual abuse.